Welcome dear all to another episode of Homeo Mitra Vartalap. In today's episode, we have with us Dr. Pratik Jariwala. If you recall, he had taught us at length to us about fever and the important investigation related to fever and how we should take help of those investigations, when to do, when not to do, and which investigations to do. Quite an informative episode it was. So I'm going to leave the link to that episode in the description. What we are going to today discuss about is lifestyle disorder and the importance of lab investigation and understanding lifestyle disorder. When I say lifestyle disorder, which means diabetes, blood pressure, metabolic syndromes, and the whole array of lifestyle disorders. So, welcome, Dr. Pratik.
Thank you so much, Dr. K.
So, what should be, what should be our outlook towards lifestyle disorder? What are the kind of lifestyle disorders that we are looking at right now, especially from lab investigation point of view? Because you are a pathologist,
right?
We would like to have your view on this.
Okay, so Dr. K. Lifestyle disorders have been showing a tremendously increasing strength. Cardiovascular diseases are the most common lifestyle related disorders that we are seeing, and the conditions with what we get out of these are we get a heart attack, we get a stroke, or we have patients with high blood pressure. Okay, this is followed by diabetes as the second most common lifestyle disorder. Thirdly, obesity, overweight, and then some cancers which we are also seeing, which can be modified because of lifestyle. So these are the commonest ones that we are seeing. Now, from a lab perspective, how do we go about with these lifestyle disorders? We look at the cholesterol levels, we look at the sugar levels, okay, we look at the BMI or the body mass index, we look at the weight of the patient. And when it comes to cancer, there are certain cancer markers which we may look upon to screen a patient for cancers or to diagnose early.
Sir, any observation or trends in the kind of let's say number of people doing these tests or number of tests coming out positive compared to the yesteryears?
Right. So compared to last several years, what we are seeing nowadays is that these disorders are affecting young people more. This is because of the sedentary lifestyle that we are leading these days. We are not following healthy food habits. There's a lot of alcohol abuse also which is there, and the most important factor is stress. Okay, we all are under tremendous stress because of whatever reason, maybe work, maybe personal reasons, or maybe travel, or whatever the case may be, and we are not able to relax our body as much as we should. Okay, there is lack of sleep, poor food habits. There are environmental factors also which are there for people like us who are living in a city. So all these factors are contributing and giving the body per se tremendous amount of stress, and which is also leading to all these lifestyle disorders and aggravating these conditions.
So, sir, any kind of, I would say, change that you have seen in terms of number of people doing the tests or screening themselves for lifestyle disorders compared to earlier, and of course the results also. When I say that, if the results, let's say there were not so many tests which were coming positive earlier, as the number increased.
So yes, Dr. KU, thanks to the social media, the medical community, there's a lot of talk about these things on your radio channels also. People are now aware that these things exist. Lifestyle disorders are serious and they need to take them seriously. And because of this, now the younger generation, the young adults who are at the prime of the young adulthood are getting themselves tested, and because of which the diagnosis is coming up early. There are many people who have these unhealthy lifestyle things or unhealthy lifestyle, and they are now getting themselves tested and identifying those factors which are affecting them and trying to prevent these disorders.
So certainly it looks like the awareness has increased. Now coming to the second part of my question, whether the number of reports turning like you have a level for cholesterol or HbA1c or something.
Right.
So like for example, I remember when my grandfather was practicing, maybe it was not maybe in his in 90s and 80s. So they would hardly go for such kind of tests. Okay, eventually, let's say when I started practicing about 15 years ago, we would do this only in someone who was age 40 and above.
Right.
And we would still not get too many positive results. Even the incidences of heart attacks and CVAs was not that high earlier.
True.
We used to see more of infectious disease, malaria, dengue, and all that, which has now the incidence is now reduced significantly.
Right.
So whether that age limit or that when it used to come positive, whether it has come down, a number of tests which are turning out positive for younger individuals, whether it has increased.
Yes. So there are two things to this, Dr. Keru. One is that previously the younger individuals would never be tested. Okay. So the incidence of testing was less, and because of which the identification was less. Second thing is that the lifestyle which was led by our seniors earlier, okay, was way more healthier than what we are leading today. So because of these two factors, okay, the testing has definitely increased, and the number of abnormal reports has also increased. We are identifying a lot of cases wherein the cholesterol levels are very high in adults who are just 25, 26 years old. Okay. We are identifying several cases who are obese, who are overweight. We are identifying several cases who are already pre-diabetic, if not diabetic. So the trend for testing has definitely come down in young adults towards a younger age. It has increased, and the number of abnormalities being identified also has increased. And there are increasingly number of young adults who have these disorders, and we are picking them up on a day-to-day basis, on a daily basis.
This is interesting that the awareness is increased, and therefore the number of reports which were done is increased, and the reports that turn out to be positive is increased.
Yes.
So, sir, if you could just list down for all of us, someone who is a layman, who is not a doctor, that the kind of tests which are most necessary.
Right.
If you just sort of name or list them for identifying such issues.
Right. So one thing is that we need to look at the common things which are there, okay, with regards to the lifestyle disorder. Something I would always encourage people to do is to keep a watch on their weight, okay, which can be easily done at home. You don't need to go to a lab. Second thing is the food that they are consuming. Now these days there's a lot of trend of fast food on all your food comes within 30 minutes and online ordering and all these things. Fine, you can have it once in a while, but overall your eating habits on a day-to-day basis should be very healthy. There should be less of oil, there should be less of salt, there should be less of bread. Okay, these three things are extremely important. So now coming to the investigations that we are observing, we are seeing a lot of individuals daily who have high cholesterol level. So definitely a lipid profile becomes a mandatory part of your evaluation. Second most common thing is diabetes. Diabetes is, again, we are seeing a lot of pre-diabetics and diabetics in young adulthood. So sugar levels, both your fasting and post levels, are extremely important to be done. Thirdly, your regular fitness parameters like your CBC to look at your hemoglobin level, okay, a ESR to look at any underlying illness which is going on. In addition to that, what I recommend is one parameter to look at your kidney health, one parameter to look at your liver health. Okay, to begin with, for young adults, I believe these many investigations are sufficient. If we find any abnormality in this, then we can investigate further. So blood investigations, these 4 or 5 investigations, and weight monitoring are good enough to look at your lifestyle illnesses when you are in your young adulthood.
Little off the tangent before we come to the next question, which would be at what age one should start monitoring.
Right.
So what is happening, sir, nowadays in these reels we are constantly looking at people talking about this test called HbA1c.
Right.
Saying that it should not go above, even if it goes above 5.6, you are already entering into a diabetic phase. If you could just comprehensively make us understand about this test.
Right. So what is HbA1c? First and foremost, HbA1c is a molecule of your hemoglobin. It is a part of your normal hemoglobin. Okay. And it indicates your average blood sugar level over the past 2 or 3 months. Okay. So now understand this, when diabetes comes, it comes gradually, it doesn't come overnight. Okay. So what happens is when your sugar levels are gradually increasing, your HbA1c levels also go on gradually increasing. Now, when we are saying at what levels should we consider a person to be a pre-diabetic or a diabetic, so generally the standards what are set, okay, across the world are that up to 5.7 your HbA1c is normal. More than 5.7 up to 6.4 you fall in the pre-diabetic category, and beyond 6.4 you are classified as a diabetic. So HbA1c, when you do the test, okay, it is just a simple blood test, and it will tell you in which category you fall. and there you can decide whether you need to do any intervention or not. If it is normal, fine, nothing to be done, just monitor it. If it falls in the pre-diabetic range, yes, you need to start taking precautions, because eventually if your sugar goes beyond 6.4, you're going to be put on medications. That is how it is.
Right, sir. So that was helpful. Now coming to what should be the ideal age when one should start monitoring these parameters.
With current scenario of lifestyle disorders, I say that as soon as a person enters in adulthood, okay, maybe at 18 or 20, that should be the time when we should start looking at these things. Okay, you need not have them done very frequently. Like in most cases, once a year is more than enough with these basic investigations. Okay, but it is earlier the better. Earlier you pick up, earlier you can modify. Something very good about these illnesses is that you can actually modify them. That's why they are called lifestyle illnesses. You need to modify your lifestyle and you can modify the illness. So earlier you identify, the better it is.
Right. The reason for me asking this question was I saw some of, or I discussed with some of the doctors that they noticed that they would find a kid overweight who was maybe 14, 15 years old.
Right.
And I don't know, out of a hunch, they did one HbA1c and it was 6, which is quite alarming for a 14 or 15-year-old kid. That is why I actually asked this question.
No, that does happen. In fact, there are many children these days who are overweight, and that is again for the reasons that we already know. That having a lot of junk food, having sedentary lifestyle. The kids are burdened with so much of studies these days. They hardly get any time for outdoor activities, or maybe they are hung up on the phone. Okay, so these are the reasons which are leading to obesity, and actually childhood obesity is also a very big issue, because these kids, even when they are growing, they are already predisposed to so many factors which lead to diabetes and hypercholesterolemia even before they touch their adulthood. So this is again, childhood obesity is a very serious factor which we need to take into account.
So which means that if the child is getting overweight, it is high time that the parent should actually get the child tested. Eventually it means not so, it should not so happen that it would, like the water would run under the bridge kind of situation.
Absolutely, and parents need to monitor the weight of the child. The parents are the first people who would come to know, okay, that the child is growing very fast or is putting on weight. And if they're not very keen on blood investigation, at least go and see a pediatrician. They will guide. Okay, but just don't sit idle thinking that, okay, he's a healthy child, he's eating well, that is why he's putting on weight. There are a lot of factors to that, and that need to be investigated.
True, sir. Yes. Sir, now going to the next question, now that we have decided that, okay, there is a certain age where it is advisable to start these tests in adulthood, how frequently should one be monitoring oneself with these blood tests?
Okay, so if the person's lifestyle is good, his parameters are normal at the first check. Okay, they don't need to do a check time and again. Patient is not underweight. Patient is not overweight. Patient is following a healthy lifestyle. He is active. He's eating well. Then you don't really need to do these investigations for in under 3 years. Okay. However, if it is the opposite, then it is strongly recommended that you monitor these investigations with a yearly checkup.
Now, as a doctor, I have observed this, and probably you must have also observed that number of people doing it regularly may not be so much for the compliance, what we say.
Correct.
For a simple reason that it costs them, number one. Number two, it is not covered under insurance because it is a preventive health checkup.
Yes.
Correct me if I am wrong. If that
is correct. That is correct. The investigations which we are talking about, okay, they are not very expensive. They hardly cost anything. It is misunderstanding that all blood investigations are very expensive. These investigations, all this put together, will not even cost you 1,000 rupees. Okay, number one. Second thing is, yes, correct, they are not covered under insurance. And one more very important thing is that not many people are aware that the government allows a deduction of up to 5,000 rupees when you do a preventive health check. So the government is actually helping you to do a preventive health check by giving you this deduction. It is covered under section 80D of the income tax. 5,000 rupees the government is going to allow.
Are there any requirement that only a certain kind of lab receipt or something like that government would allow, or it is any lab?
No, you can go to any lab provided the lab report is signed by a pathologist. If that criteria is fulfilled, then you can go to any lab.
So this is new to me, because for what I recall is that earlier allowances were given by companies for
True.
doing some number of tests, some
Yes.
number of consultation. But this is something which is news
Yes.
to me.
Yes.
Okay. Do let me know if any one of you already knew about this, so that we understand how much awareness is there about this topic overall. So, sir, another interesting question which came up is, when you have a fever, many times patients ask, okay, fine, we are going for a, let's say, CBC, dengue, MP, and all that,
Correct.
for fever investigations.
Correct.
Why not do those cholesterol, HbA1c, and all that in that blood draw itself?
Correct.
Meaning those health packages which are often there, why don't we do them at that point of time?
Correct. So this is actually a very common thing, and it's a very good question, Dr. KU. We see many a times, people who are acutely ill with fever or having some surgical intervention, they come for their regular investigations, and at the same time they think, okay, I might as well do a package, it will save some cost on me and I will get to know my other parameters. Now, however, we need to understand that whenever the body is undergoing an acute condition, the metabolism of the body is altered. It is a hypermetabolic state. And when you do investigations like cholesterol, sugar, okay, or a preventive health check, in such patients, there are many parameters which are haywire. So, for example, your cholesterol levels, they tend to fall drastically whenever you have fever. So, when you do a cholesterol level at that point of time, you will feel, okay, my cholesterol levels are normal, wherein actually they may be high. The same thing happens for sugar. Your sugar levels, they tend to fluctuate so much. Sometimes you will end up with a very high blood sugar when you're not well, and you may be wrongly diagnosed as a diabetic. So it is strongly discouraged to do a preventive health checkup when you are acutely ill. It is always better to go by the tests which are prescribed for you when you have an acute condition. You can do all these packages or preventive health checkup once you are out of that condition and you are fine and you are stable, maybe after a few weeks. Okay, but certainly not when you are acutely ill.
I think now it makes sense, because your body itself is not in that state to give a very
Absolutely.
accurate indication of whether those parameters are altered.
Absolutely. So for us to look at lifestyle disorders, we need the body to be at resting state. That is when we see that, okay, in a resting state, your cholesterol levels are high. That means you are at an increased risk of myocardial infarction, or your sugar levels are high. That means there can be a risk of diabetes. But all these parameters done when you're not well don't make any sense.
Right. So that is something which is very interesting. So now another topic, because these heart attacks and CVAs and all that are on the rise. If you could tell us something about those specific cardiac markers. Now, one thing which I've noticed which is different in lipid profiles than from earlier is they've started including a parameter called as apolipoproteins.
Yes.
This is a question both for patients as well as for doctors. If you could comprehensively help us understand this particular cardiac risk markers, homocysteine also. Now, that is something
Right.
which we are seeing that people are doing regularly.
Right. So apolipoproteins, what are apolipoproteins? They are protein bound to lipids. So there are typically two types of apolipoproteins we look at. One is apolipoprotein B, which is associated with the LDL cholesterol or the bad cholesterol. And we look at apolipoprotein A1, which is associated with the HDL cholesterol. So typically when we are doing an extended lipid profile, we look at the apolipoprotein B to A1 ratio. Okay, and that ratio, if it is less than 0.7, we take it as a good factor. That means that the amount of good cholesterol and bad cholesterol are balanced at a certain level, and which is a good thing. However, if the ratio goes on increasing, that proportionately increases the risk of the cardiac event. So that is one thing. So those are ApoB to A1 ratio apolipoproteins. Okay, then we talk about homocysteine. Now, hyperhomocysteinemia or increased levels of homocysteine, they are also associated with increased risk of thrombosis. Thrombosis means clotting of blood. Okay, so these blood clots, they tend to get disseminated and they can get stuck in your brain and give rise to a stroke, or they can get stuck in the heart and give rise to a heart attack. Okay, so these small clots can be formed because of high homocysteine levels. So that is again one of the cardiac risk markers which is being very commonly evaluated, and we are seeing many cases with high homocysteine levels. Now, high homocysteine levels can be because of two reasons commonly. One is that it is familial. Okay, so because of some genetic abnormality, but that is rare. Most commonly it happens because of vitamin B12 deficiency. So If we correct the B12 deficiency, the homocysteine levels are automatically corrected. So for such cases, when we are assessing, we might also want to look at a vitamin B12 level, okay, which of course forms a second line of investigation to actually see if they are low and if it can be corrected.
Right.
Thirdly, there is one cardiac marker called HSCRP. Right now, you must have heard of CRP. When
Yes.
we are having a fever or any acute condition, we look at the CRP levels to
Right.
assess how high the CRP levels are. Now, there is something called as an HSCRP, which is a more sensitive marker, okay, but it is not to be done in fevers, because fevers it will be high only. Again, when the body is at a resting state, we do an HSCRP level, and an HSCRP level more than 3 indicates that a person is at a higher risk of heart attack or a cardiac event. And there is one more marker called LPA, lipoprotein A2, which is again a type of lipoprotein, okay, which if elevated is again considered as a risk factor for your cardiac health.
So, sir, what I understand is that if your lipid profile is deranged, then you do an extended lipid profile, which gives all these differential lipoproteins which come up.
Yeah.
And the homocysteine level and high sensitive HSCRP, that should be done in cases where we know that there is a family history. Like, how do we decide which test?
So ideal cases, okay, we are still doing the lipid profile, okay, but extended lipid profile with apolipoprotein should be the first line investigation over a lipid profile. Lipid profile definitely gives us very good information, but apolipoproteins will give you some additional information in the extended lipid profile. So given a choice, always choose for an extended lipid profile. Okay, followed by the other investigations which we spoke about, that is the HSCRP, the homocysteine, and the LPA2, lipoprotein A2. Okay, those things can come as a second line investigation. Okay, or if a person is not having a healthy lifestyle, okay, you might as well screen that patient with a complete cardiac risk panel, okay, and look at all those parameters if they are elevated or not. So lipid profile, yes, a basic, okay, but if the patient is not healthy or not leading a healthy lifestyle, we can always look at the complete cardiac risk panel. This is a cardiac risk panel, okay, wherein looking at all the different types of cholesterols, homocysteine, HSCRP, etc.
So, does something like this actually exist? Is there a cardiac risk? Is there a cardiac risk panel which is there as part of, like, how we have a
Yes.
fever panel? Like, is there a
Yes.
cardiac risk panel?
Yes,
which is
cardiac
also-
risk panel is very much there. However, it is not recommended in the younger individuals. It is a part of the higher packages, because the number of investigations increase. It is certainly there, and at least I believe everybody should go through it at least once in their initial days.
Now we are going to a small segment for doctors. So if you are a patient, you can listen to this, but there will be some technical terms which will come up. So I'm not sure whether you want to continue. But nonetheless, sir, about doctors, now as a doctor, I had one query that when we look at blood reports coming from different labs, okay,
Yes.
now what happens? Patients sometimes ask that, okay, my hemoglobin was 12.4 over here, it is 12.2 over here.
Right.
Or my cholesterol was 200 over here, it is 180 over here in another lab.
Right.
Now we see these differences. So
Right.
if you could help us understand why these differences are there, and when
Right.
it is that we should go, like how we have a second opinion in doctors, like,
Correct.
okay, this doctor is not able to diagnose, we go to another doctor. Similarly, when do we decide if we need to do investigation from another lab?
Right. So primary thing, Dr. Keyur, we all need to keep in mind that there are a lot of physiological fluctuation in any parameter you take in the body. Okay, it can be sugar, it can be your hemoglobin, it can be your cholesterol. So for every parameter, there is at least 10 to 15% of fluctuation which happens on a day-to-day basis. Every day it is going to be a little different. So when you tell me that, say for example, on one day the cholesterol was 200, and you go to a different lab after a couple of days and you say that the cholesterol was 180, okay, it means the same. Okay, because it is not that the lab results are different, the results are different inside your body. There are changes physiologically happening and the parameters are fluctuating. Okay, now if you suspect, okay, you have one of your patients who comes up with a high cholesterol and you feel, okay, it cannot be so high, I have put in home treatment. Okay, so what things you need to keep in mind when you are looking at the report? First and foremost, where the report has been done. The report should be done at a standard lab, a well-reputed lab, and which is monitored by a pathologist, right? Number one. Second thing is, it is preferred to have the reports done at an accredited lab. Okay, some accreditation like CAP or NABL, okay, should be present preferably. Okay, if these two criteria are fulfilled and you are still suspecting that okay, maybe there is something wrong with the lab report, then go to a similar lab with a similar standard. Okay, don't go to a lab just around the corner because it is convenient. Okay, because we don't know what kind of work is happening. So always pick up a standard lab, and if you're still suspecting, okay, you can refer the patient to another standard lab of equal repute. There is one more third option is that you can tell the patient to get the repeat investigation done. That you can talk to the lab directly that this particular patient has shown so and so result. Okay, but I'm not expecting this. Can you just recheck? Okay, the lab will be more than happy to collect a fresh sample and get it done with themselves.
Right. So even this kind of communication can be done.
Yeah, this communication has to come from doctors. Basically, what happens most of the time, the doctor would say, okay, this doesn't look right. You get it repeated at some other lab. Okay, it is still possible that the result is correct. So just pick up the phone, speak to the lab, and they will be happy to recheck it for you.
Like that blood sample is still there with you, it is viable for some time, and therefore you can use the
So blood samples are usually for these parameters, they are kept for a day. Okay, if it is beyond that, then we will have to collect a repeat sample.
Right. Okay, I think this more or less answers all of the questions. One thing which I found interesting in the conversation which you said is monitor your weight and activity first.
Yes.
Then you don't have to really worry about those blood tests. And the second interesting thing that came up is the government gives you deduction in tax,
Right.
and therefore and the amount. I mean, basic amount of 1,000 rupees a year per person. Let's say if it is a 4-person family also in the adult age,
It still covers.
huh,
The government allows 5,000.
5,000 rupees.
Okay.
So, which is again interesting.
So with regards to what I mentioned, with regards to the weight and lifestyle, okay, it is, yes, these two things are the most important things. Okay, however, there are some very rare cases, okay, wherein, as I mentioned, hyper homocystinemia, which is familial or genetic. Okay, so in addition to lifestyle, what we have to also keep in mind is that many of these conditions have a familial tendency. Okay, there is some gene mutated somewhere which is giving rise to these things. Like diabetes has if you have a very strong family history, the diabetes is going to come eventually, sooner or later. If you have a very strong cardiac history, you are also predisposed to cardiac event. So when these things are existing, it is always better to get a baseline blood investigation done as early as possible so that we know where the patient is, placed.
I hope people watch this, probably accept it, because acceptance is something without which these
Correct.
things cannot be done. Do leave some questions if you have in the comment section below. I am sure we will have another round of Vartalap with
Sure.
Pratik sir, and we will try to take up those questions. So for now, thank you very much, everyone.
Thank you.
And thank you, Pratik sir, for your time.
My pleasure. Thanks for making me a part of this podcast. Thank you so much.
Thank you so much.